scenario from nervous system. Okay, Ms. Katoya, you can take it away.
Okay. Your answers are A, 64493, modifier 50, 64494, modifier 50, M51.36. B, 64483, modifier 50, 64484, 64484, M51.36. C, 64493 with a modifier 50, 64494, 64495, M51.36. D, 64493 with a modifier 50, 64494, 64494, M51.36. Preoperative diagnosis: 1. Low back pain. 2. Degenerative lumbar disc. Postoperative diagnosis: 1. Low back pain. 2. Degenerative lumbar disc. Procedure performed: bilateral paravertebral facet joint injection of steroid at the L3, L4, and L4, L5 with fluoroscopic guidance. Description of procedure: the patient was transformed to the operative suite and placed in the prone position with a pillow under the abdomen. A smooth IV sedation was given with midazolam and fentanyl. The patient's back was prepped with betadine in a sterile fashion, and we used lidocaine 1% plain as a local anesthetic at the injection site. With the use of fluoroscopic assistance, first to the right and then to the left 20 degrees, the Scotty dog view was identified, and we were able to place the spinal 22 gauge needle first to the right L3, L4, then to the right L4, L5, then to the left L3, L4, and then to the left L4, L5. We used a lateral X-ray to access the proper placement of the needle. We proceeded to inject a mixture of 4 milliliters of 0.25% Marcaine plain plus 80 milligrams of methylprednisolone divided between the 4 joints. The needles were removed, the patient's back was cleaned, and a Band-Aid was applied. The patient was transferred to the recovery area with no apparent procedural complications. What are the CPT and ICD-10 codes? You have 2 minutes to solve.
Okay, Chorus, that is time. I give you some extra time for this scenario as well. This is also good. A tricky scenario, I would say. We have post-operative diagnosis as low back pain, degenerative lumbar disc, and procedure performed. We have a bilateral paravertebral facet joint injection of a steroid that has been given at L3 and L4 and L4 and L5 with a fluoroscopic guidance. So the patient was placed in the prone position. IV sedation was given. Fluoroscopic assistance was used. Spinal gauge needle was also used, and right L3, L4, and then to the right L4, L5, followed by left L3, L4, then to left L4, L5. X-ray access was used to ensure proper placement. Margarine plane plus to 80 mg of methylprednisolone was also injected. The correct answer is going to be option D. So we have our procedure inventory as a fluoroscopic guided bilateral paravertebral facet joint injection of steroid given at L3 and L4. And diagnosis inventory, we have degenerative lumbar disc and low back pain. So in the FDR, we have our FDRs from MCG manual for paravertebral spinal and nerve branches. The code ranges are from 64490 to 64495, and these are your FDRs. So we'll review them as well. And in the diagnosis inventory, we don't need to code the low back pain because that is a symptom or a sign of a degenerative lumbar disc. So once we have a definitive diagnosis, no need to code the signs and symptom. And yes, let me help you understand the anatomy of a facet joint with the help of this image. So you can see the facet joints. These are the joints in the spine which are located in the back, in the posterior aspect of your spine. So there are facet joints at each vertebral level, one on each side of the spine. So over here between L3 and L4, you can see one facet joint at the right and one facet joint will be there in the left as well. Similarly, between L4 and L5, we have one facet joint at the right and one facet joint at the left as well. So these are the facet joint at each vertebral level, and these joint will provide flexibility and stability also. Okay, so is anatomy clear for us of the facet joint? Good. Okay, so how many levels are there? Yes, we have two levels exactly. Exactly. Between L3 and L4, we have one level. Between L4 and L5, we have the second level. Also, the FDR says that we have to code according to the level and not to the injection, right? And all the image guidance are also included. So we have to code as per the level. We have two levels. Let's keep that in mind. And let's have a look into option B. It is coding for 64483. And 64483 is for injection, anesthetic agents, and or steroid transforaminal. So did we had a transforaminal epidural injection? Let's cross check with the procedure inventory. No, right? We didn't add a transforaminal epidural injection. We had a paravertebral facet joint injection. So both procedures are different. So that means option B is going to be a wrong answer. Now let's next look at option C. That's for 64493. 64493 is coding for injection, diagnostic or therapeutic agent, paravertebral facet joint with image guidance of lumbar or sacral single level. 64494 is coding for a second level of injection, good. And 64495 is coding for third and additional level. Well, we already discussed that we had only two levels and we have to go according to the level and not according to the injection. So we have just two levels. That means we don't need to code 64495, which also means that option C is incorrect because that's coding for a third and additional level as well. Okay, so option B and option C we have eliminated. Now it's between option A and option D. Option A is coding for 64493. Both are having same CPT code, only difference is in the modifier. Option A is coding for 64493 50 modifier, 64494 50 modifier, and 51.36. Okay, so 64493, in the normal circumstances, I can understand that a 50 modifier is used to indicate that the procedure performed was on a bilateral for both laterality or for a bilateral procedure. But in this scenario, option A is incorrect because of this guideline, which states that for paravertebral bilateral paravertebral facet joint procedure, report 64490, 64493 with a 50 modifier. So we will code the first, that is a primary code, with a 50 modifier. Okay, that's correct. We coded 64493 with a 50 modifier. Also report the add-on codes 64491, 64492, 64494, and 64495 twice when performed bilaterally. So that means we should not append 50 modifier. The next line is also states that do not report a 50 modifier in conjunction with 64491, 64492, 64494, and 64495. Yes, so we should not append a 50 modifier. That means option A is incorrect, which is coding for a 50 modifier with 64494. Instead of that, we should have coded 64494 twice. So option A is incorrect as well. The correct answer is going to be option D, 64493 50 modifier, 64494, 64494 with M51.36 as the diagnosis. So this is why I would always say coders churn your manual. So if you have chunked your manual, these guidelines will be easily visible and you can select the correct answer during the exam within a short period of time. Otherwise, we have to read all the guidelines and that would consume a lot of time, right? So churn your manual, churn all those guidelines in the CPT book, which will make it easy during the exam. Okay, coders. So with that, we will move on to the next scenario. I hope the explanation helped. If it didn't, please let me know in the chat. I'm happy to help. Okay, so let's move on to the next scenario. And once again, Ms. Katoya, please and thank you.
Okay. What are the CPT and ICD-10 codes? A, 68810 with a modifier 50 H04.553. B, 68811 modifier 50 H04.553. C, 68840 modifier 50 H04.553. D, 68816 modifier 50 H04.553. Preoperative diagnosis, dacryostenosis both eyes. Postoperative diagnosis, dacryostenosis both eyes. Procedure performed, nasolacrimal duct probing both eyes. Anesthesia general, condition to recovery satisfactory. Counts, needle count correct. Estimated blood loss less than 1 milliliter. Informed consent, the procedure risks, benefits, and alternatives were thoroughly explained to the patient's parent who understands and wants the procedure done. Procedure. The patient was prepped and draped in the usual sterile manner under general anesthesia. Starting on the right eye, the upper punctum was dilated with double-ended punctal dilator and starting with a 4O probe, increasing up to a 2O probe. The nasolacrimal duct was dilated until probed patent. Then, using a curved 23 gauge punctal irrigator, 0.125 milliliters of saline fluorescein stained saline was easily irrigated down the nasolacrimal duct into the nostril, where it was carefully collected with a clear number 8 catheter. The instruments were removed and an identical procedure was done on the opposite eye nasolacrimal duct. Tobradex eye drops were placed in each lower cul-de-sac. Excuse me. The eyelids were closed. The patient left the operating room for recovery in satisfactory condition. You have 2 minutes to solve.
Great answers, coders. Great way to end the nervous system chapter. So we had dacrostenosis of both eyes, nasolacrimal duct probing of both eyes as well. General anesthesia was given. Punctum was dilated, and a nasolacrimal duct was also dilated. A curve 23 gauge punctal irrigator was used. Sterile fluorescein stained saline was used to irrigate down the nasolacrimal duct. It was carefully collected. An identical procedure was done in the opposite eye of nasal lacrimal duct as well. The correct answer, as most of you have placed in that chat, it's going to be option B. So we have diagnosis inventory as a dacrostenosis of both eyes. And yes, so this is what a dacrostenosis look like. It's simply but a blocked tear duct. So what procedure the doctor has performed is he has done a probing of nasolacrimal duct, and this involves passing of a probe into the nasolacrimal sac and down through the nasolacrimal duct to open any obstruction at the lower end of the duct. So you can see how a probe was inserted and the obstruction can be cleared. And this is the image of a dacrostenosis or a blocked tear duct. Okay, so the physician can perform this procedure usually without anesthesia in office setting or under general anesthesia in operating room as well. And the procedure inventory, we have nasolacrimal duct probing, bilateral, and yes, so it's option C 68840 is coding for a probing of lacrimal canaliculi with or without irrigation. Cross-checking with our procedure inventory, we had a nasolacrimal duct probing and not a lacrimal canaliculi. So option C is incorrect. So for the rest of the codes, I've done a little bit of churning as well. So you have option D 68816, which is coding for probing of nasolacrimal duct with or without irrigation with transluminal balloon catheter dilation. We didn't have any transluminal balloon catheter used. It was just a nasolacrimal duct probing performed with the help of a syringe or needle, sorry, with the help of needle. So option C is also incorrect. And between option A and option B, only difference is that option A is performed without general anesthesia. Sorry, option A, yeah, 68840 is performed without general anesthesia, while option B, 68811 is performed with general anesthesia. So carefully reading the procedure note, we can see that the procedure was performed under general anesthesia, and that means option A is incorrect, and correct answer is going to be option B, 6881050 modifier H04.553, and that's your answer. So yeah, this was a pretty straightforward one. Only we have to create the scenario carefully. Well, good job, coders, great job.
Thanks for tuning in, and until next time, happy coding.